TopMedTalk.
Welcome to TopMedTalk. This piece comes from our live coverage of Anesthesiology 2022. It is the single largest gathering of anesthesiologists in the world and the annual meeting of the American Society of Anesthesiologists. Now, our live coverage is available now at live.topmedtalk.com. More details in the show notes. Don't forget to subscribe, and please help us boost our signal by sharing this podcast wherever and whenever you can.
Hello, I'm Sol Aronson. I'm here as a substitute for Desiree Chappell for TopMedTalk 2022 at the ASA, the American Society of Anesthesiologists meeting in New Orleans, Louisiana. And I'm here with Robert Canfield from Fresenius Kabi, who's going to share with us a little bit on his story of infusion pumps. But before we get there, I just want to do a shout out to all of our sponsors here for TopMedTalk. Without our sponsors, we wouldn't be able to fulfill our mission, which is, of course, to provide free education to anybody in the world who wishes to sign in and enjoy our content, which you can find at live.topmedtalk.com. If you're in the area, we're at booth 2245. Come join us and participate. We are here because of our sponsors. Particularly, I want to do a shout out to Edwards Life Science and Medtronic for giving us the resources to be able to put on these kinds of shows and to deliver this education content for free. And a particular shout out to the ASA this year, who has given us the opportunity to have space at this beautiful booth here in the convention hall. Without their support, we wouldn't be here. With that said, I want to just move right on and introduce our next guest, Robert Canfield. I'm going to give you a chance to introduce yourself, if you will, with more detail, and we're going to jump right into some game-changing technology in the infusion world. Robert, tell us a little bit about yourself, if you will.
Sure. So I'm Robert Canfield, the Director of Marketing for Fresenius Kabi. I came from the Ivenix Infusion Systems, Ivenix Incorporation acquisition. So Fresenius Kabi this year acquired Ivenix, the game-changing infusion system that we'll talk about. I've been the acting director supporting that product for about a year and a half. And prior to that, I worked at two other major manufacturers of infusion pumps. A lot of my experience is in product management and cybersecurity.
So you've been in the infusion pump space for about 2 decades or so.
Yes, sir.
Not many people can say that.
No.
How does one go from cybersecurity to infusion pumps? And give us a little bit about that journey.
Sure.
History.
My background is a bit of a strange journey. I started in business products and learned networking, and that allowed me to support infusion pumps when they became networked. So product management for cybersecurity was a really big deal about 20 years ago. Took on a project to certify one of the products on the market to get it into the Veterans Administration. A very high level is required to get cybersecurity for infusion pumps into the Veterans Administration. So that allowed me to get into marketing and product management. And I'm a bit of a hardware nerd, so there's a bit of hardware to an infusion pump, as you know. So just a jack of all trades in that space, if you will.
Interesting. And so Fresenius Kabi acquired Ivenix recently.
Yes.
And that's going to enable the distribution of this differentiated technology to the world of anesthesia. But before we get into that, help us understand why it's different. What is it about this new technology that's unique?
Yeah, definitely. So the Ivenix infusion system started as an idea. We realized there are a tremendous number of problems with infusion therapy in the market. Infusion pumps are not as accurate as they could be, challenged with delays in therapy because of the bag height restriction that a lot of infusion pumps on the market have, and the usability, just programming the pump. Some of them are a 9-key text like an old flip cell phone. Some of them are like an ATM machine. So that whole world needed kind of a modernization, if you will. From an anesthesiologist standpoint, anesthesiologists want a product that is super easy from start to finish. They've got a lot going on. They want something that's simple to use, whether it's the administration set, the actual tubing, using that in a gravity drip way and being able to control that in a very strong way, loading that into the pump and programming the pump very quickly. The alarms for the infusion pump, they don't want to have as many alarms as, say a bedside nurse would have, right? They don't want those distracting notifications that, they know what they're controlling. They're in charge of what's going on. And then from an anesthesiologist standpoint as well, the drug library in the infusion pumps is how we control the safety of that infusion, right? You're going to head against a limit when you're programming that pump of you could come close to overdosing a patient. Well, with anesthesiologists, they want that to be a little bit wider because they don't want those notifications that they're going to be overdosing or underdosing when something's in a very urgent situation and they need to give a really good bolus of medication, something very quick. They want to be less limited in what they do. So we've made it so that they can customize that and be less limited, but still be safe.
So the infusion pump, if I may, has broad guardrails to apply to many settings, but you're enabling a customization specifically for the anesthesiology perioperative delivery of care to more likely fulfill our specific needs. Is that right?
That's exactly right. We really want to fulfill your needs and make it customized to your needs in a very granular way. Right, we want you to contribute to the building of that drug library by collaborating online. You can give your feedback about the build of that drug library. I want this limit to be this wide for this reason. But yes, Mr. Pharmacist, building the drug library with me, this is an overdose. This is something I would never, ever do. And thank you for protecting me is kind of the approach. Right. I think a lot of anesthesia professionals are a little more willing to listen to that level of protection that is protecting them as well as their patients. And that's what we've tried to do is give that balance of giving you control and power over that drug library, but also keeping things safe.
And how does the anesthesiologist learn more about this product and be able to sort of contact Fresenius Kabi to learn more about the product?
Sure, yeah. So we're here at the show. You can stop by if you're at the show this week.
And for our audience who's not physically at the show, what can we tell them and how can we direct them?
Definitely. So we have a website, Fresenius Kabi USA. You can also go to ivenix.com. That's still an active website for you to get information about Ivenix specifically.
Well, I can tell you just from a user of years ago, there's something more frustrating than alarm, which, portends alarm fatigue and the aggravation that goes with that. So simple and easy is always the mode. What else do we need to know? Should we need to know about this product as it is a game breaker in the very now congested space of infusion pumps?
Yeah, sure. I think the biggest thing that has been exciting for me is the accuracy of the device in all clinical conditions. So no matter where you position the pump, the bag, the patient's location, heart height is important with some infusion pumps. None of that matters to our infusion pump. Because of the way we pump, we both measure and control what we're infusing. So the pump is extremely accurate. For a large volume pump, sometimes that doesn't really matter. It's just hydration. We always want to be as accurate as we can, but let's be honest with each other. Hydration isn't as big of a deal as, let's say, rocuronium, right? If we're infusing something that's extremely impactful to a patient, we want to be in very tight control of that infusion. And the technology we're using to provide that infusion levels out that spike and trough that you might see in some infusion devices where the mechanics are kind of balancing out. We call it a trumpet curve, right? The infusion starts off and there's quite a lot of a bolus dose or an underdose. And we've balanced that out so that the infusion is accurate from start to finish.
Excellent. All right. Thank you. It's been a pleasure to meet you. I know it's been a tough haul for you because you're a little bit under, the weather, and I really appreciate you coming out here and sharing that message with us. And for those who want to learn more, please go to the Fresenius Kabi website to learn more about this infusion pump. Its name is
the Ivenix Infusion System.
The Ivenix Infusion System. Thank you very much.
TopMedTalk. Thanks for downloading TopMedTalk. Don't forget to subscribe via your podcatcher. Don't forget to check us out on social media. We're on Twitter, Facebook, LinkedIn, and YouTube. And also, don't forget, TopMedTalk is the broadcasting arm of EBPOM, Evidence-Based Perioperative Medicine. We'd love you to find out more about that. If you check out ebpom.org, you can find low prices on some of the conferences we're organising around the world. Many of them are virtual and don't even involve you leaving your own home. Check out edpom.org now.